Good afternoon. I want to start with an update on COVID-19 cases and hospitalizations. Yesterday, over 9,000 tests were reported and around 500 new cases were confirmed positive. As of yesterday, over 700,000 people have been tested across the Commonwealth. The average positive test rate is down to about 3%. This is a 90% reduction in the number of positive tests per population tested since April 15th. Roughly 1,000 people remain hospitalized due to COVID-19. That number is down over 70% since the middle of April. And yesterday's numbers were consistent with what we've been reporting over the course of the past few weeks, continued positive incremental progress. We're about a week into phase 2 of the reopening process. Outdoor dining, hotels, and activities like summer camps are coming back. Things may look a little different, but thanks to everyone's creativity and commitment, we're reopening and effectively bringing the fight to the virus at the same time. Our progress to date is encouraging, but it doesn't mean the virus has left town. Until there's a medical breakthrough with a treatment or a vaccine, it's up to all of us to continue to do the things that we know can kill COVID. Face coverings, hand washing, distancing, monitoring for symptoms, and getting tested when appropriate is how we fight COVID-19 and continue to reopen Massachusetts. People of the Commonwealth have done extraordinary work over the course of the past 120 days to get us to this point. And we just ask you to please keep doing all you've been doing to fight COVID while we continue to move forward here in the Commonwealth. As part of our effort to adapt to the state's response to COVID-19 and bring every resource we can to stopping the virus, our administration is going to launch 50 pop-up COVID-19 testing sites throughout the Commonwealth for individuals who have recently participated in large gatherings. These free testing sites will be available at over 50 sites throughout Massachusetts on Wednesday, June 17th and Thursday, June 18th. We're urging anyone who has attended a large gathering over the last 2 weeks to get tested for COVID-19 at one of these sites. Test results will be provided to each participant confidentially. A full list of the testing sites will be available at mass.gov/gettested. I also want to thank my friend, State Representative Carlos Gonzalez, the chair of the Black and Latino Legislative Caucus, for his advocacy around launching these testing sites. Obviously, there's been a significant increase in the number of people participating in demonstrations across Massachusetts and around the country. Thousands of people have been congregating in large groups over the past several weeks to exercise their First Amendment rights in the wake of the George Floyd murder. These gatherings are coinciding with reopening, meaning more and more people are moving around with each other. It's not the first time we've seen protesting and demonstrations during the pandemic, but it's certainly been the largest number of participants. And any time large groups of people come together, there's a risk for transmission. We certainly support people's rights to express their views peacefully, but we need to keep up our fight to slow the spread of COVID-19 here in Massachusetts. Some people who have the virus don't show symptoms and could spread the virus to others, including family members. By getting tested, you can help keep yourself and your close contacts safe from the virus. Everyone's done amazing work to keep people safe. Distancing, wearing face coverings, washing their hands, washing surfaces, scrubbing with disinfectant, and monitoring for symptoms. And the data is bearing this out. The numbers continue to show very positive progress. For individuals who have taken part in recent large gatherings, getting tested this week on one of those 2 days is another important way to play your part in slowing the spread of the virus. So please, if you are at a large gathering in the last couple of weeks, check out the website and find a testing site near you. If you're healthy and feeling fine, you should consider getting tested anyway. Preventing the spread of COVID-19 is also about protecting other people around you: moms, dads, grandparents, aunts, uncles, brothers, sisters. And I want to thank you all very much as a Commonwealth for your continued collaboration as we fight the virus. And now I'd like to turn the floor over to Secretary Sudders to provide a few more details on this announcement and other updates from the Command Center.
Thank you, Governor, Lieutenant Governor. Good afternoon. As the Governor said, we're encouraging individuals who've been in large gatherings over the last 2 weeks to utilize these pop-up sites this week, this Wednesday and Thursday, to get tested. The sites are available across the Commonwealth, and the Command Center has worked with healthcare partners trusted by their communities to quickly stand up over 50 sites in all parts of the Commonwealth. In fact, there's 52. They include hospitals, community health centers, and CVS. We're thankful for the cooperation of these partners who have stood these sites up quickly, which include Bay State Health, Berkshire Medical Center, Beth Israel Lahey Health, Brockton Community Health Center, Brookside Community Health Center, the Cambridge Health Alliance, Community Health Connections, CVS, Fairview Hospital, Lawrence General Hospital, Lynn Community Health Center, MGH Chelsea, Outer Cape Health Services, Manic Community Health Center, and UMass Medical. Please visit mass.gov/gettested to find the site closest to or most comfortable for you. Throughout the pandemic, the Command Centers continue to work to expand both access to testing and the Commonwealth's testing capacity. We've increased our testing capacity to 30,000 tests per day, with 45 labs processing tests. Over the last several days, we've averaged over 10,000 individual tests per day. The administration submitted our testing strategy plan to the federal government a few weeks ago to further expand testing. The plan includes increasing lab capacity to 45,000 by the end of July, reducing and maintaining a positive test rate to less than 5%, ensuring on-demand access to testing for all symptomatic individuals and their close contacts, increasing access to testing for vulnerable and high-risk populations, such as the announcement today, building a testing infrastructure to support a potential second surge, modernizing our public technology infrastructure to provide real-time data on cases and testing, and operating best-in-class contact tracing. Testing is a critical part of our plan to stop the spread of the virus. The other important parts continue to be social distancing, face coverings, hand washing, and sanitizing. Understanding that it is difficult to engage in social distancing during a time of protests and mass gatherings, it is important that any individual who participated in a large gathering over the last few weeks get tested. It's free, and you can help stop the spread. You're helping to keep your loved ones and close contacts safe by getting tested. Also, starting today, we will provide the total number of tests that have been conducted in addition to the total number of people tested. The fact pack actually states people who have been tested, not the total tests. So to be completely clear, both will be listed starting today, total tests and total people. Thank you. Governor?
Questions?
When can you say step two? Like, if the state is showing such positive progress the way it is, how soon can people get their nails done?
Is that a personal question or a journalistic question? I think we continue to follow the data, and I think by the time we get to the end of this week, we'll probably have an announcement to make on that.
Governor, are you confident in the ability of municipalities to enforce the mask order and additional restrictions on public gatherings, considering reports across social media and just in town groups about people not following those restrictions on a daily basis?
You know, the Lieutenant Governor and I spend a lot of time talking to our colleagues in local government about the orders, about the reopening process, about the protocols, and a lot of the feedback that we get from them goes into the way we formulate those policies and those protocols, and we try very hard to do it in a way that they believe makes it possible for them to serve as sort of the eyes and ears on the ground in their communities. And while there are communities that have done more than we've done in some cases or gone farther, for the most part, I think people at this point feel pretty confident and comfortable that they understand what we are trying to achieve. They understand the data and the feedback that they make available to us improves the quality of the guidance that we put out there, and I think generally are pretty comfortable with the role that they have. And if they have issues on this, they raise them. They either raise them with the Lieutenant Governor, they raise them with the Secretary in the command center, or they raise them with us.
Are there any examples of concerns they've raised that are now being either revisited or retooled?
I think a lot of the rules around outdoor dining spent a lot of time getting processed to make sure that they felt that they could actually do what they needed to do at the local level to implement it. And the development of that program that the Lieutenant Governor announced last week with respect to making resources available to communities that want to try and do something to enhance and improve the quality of the outdoor dining experience or rework some of their streetscapes came out of those conversations.
Governor, question. For 2 weeks, the state has been reporting how many antibody tests are being performed, but have not disclosed essentially the results of those tests. Do you guys have a sense of how much have come back percentage-wise with antibodies, and can you draw anything from that data at this point? It's been 50,000, pretty large.
I mean, we've said before that we talked to the medical advisory board a lot about antibody testing, and it's definitely an evolving science. I don't know if you want to speak to this one, Secretary, but our view on it is we believe as it evolves, it will become, as we've said before, clearer which tests are sort of signed off on by the feds as being the most efficacious and accurate. And we're hoping to be able to include that as part of our go-forward strategy with respect to surveillance, especially around how many people have actually gotten the virus but may not have ever been reported.
Are you concerned at this point it's still not reliable enough to report that data?
The Medical Advisory Board has referred to it in our conversations as an evolving technology, and on a small scale basis, for example, I think we all would agree that the work that was done by MGH in conjunction with the City of Boston was done under sort of a controlled research environment. But if you start getting into a grander scale use of this, I think we would like to get a little more positive feedback from the advisory board.
Governor, I was wondering if I could get a comment from you on the death of a veteran.
I have two of you talking to me at once here, Jonathan.
There was a veteran that died in Bedford, a 62-year-old, and it's kind of outrageous. The veterans groups are really concerned. This guy was missing for a month and ended up being at the VA campus. It's complicated by the fact that he lived at a privately run place being leased by Caritas. Are you guys looking into this, and can you comment on it?
The answer is we've had informal conversations with the people who are involved in this. We haven't made a decision about whether to enter into a formal investigation. But obviously the whole thing is a terrible tragedy.
How about the protest? It's been about 2 weeks since the big protest in Boston occurred. It's about 2 weeks. I'm curious, we have yet to really see a big spike in it. Is that encouraging, or is it really just too early to tell whether or not the protest have had an impact on things?
Well, I think part of the reason we're making the announcement that we're making today is we started thinking last week about creating some mechanism to make it possible to get some sense about whether or not there was, in fact, transmission that came out of the gatherings that have taken place so far. And part of the reason for doing them in a wide variety of sites around the Commonwealth is because I think there were almost 300 events of one kind or another that took place that had more than 100 people. And as you all know, many of them had more than 1,000. And while a lot of them, people wore face coverings and they were outdoors and people were moving, there was also a lot of chanting and yelling, and those right up there with singing is one of the things that a lot of the medical community worries about. And I think this is one way of trying to encourage people to get tested, not just for themselves, but also for those who are their close contacts. And as I said, anytime you have a big group that gets together like that, it can be risky in this environment. And we would like to see what some of that data shows. Say again? I view that stuff at this point as sort of too soon to tell. I mean, it can take anywhere from 2 to 3 weeks to start to show symptoms.
What do you think about the nuts and bolts of the testing program you're announcing today? Do people have to make an appointment? Do they just find out where it is and show up? And is there any thought to
No, the weekends actually end up being less
Well, yeah.
great from a testing point of view.
So the 52 sites across Massachusetts, the nuts and bolts of it, if you go online, some of them are by appointment, and some of them are walk-ins. So we make it very clear on the website which ones are by, some are a combination walk-in appointments, some are appointments only, some of them are walk-ins only. One of the things we asked all of our partners was to flex their time, because a number of them already do testing, so it was very important. We didn't want to tax the testing capacity we currently have, so that we're assuming, and we would be thrilled if we actually had an additional 10,000 people tested each of the 2 days. So we've planned for an additional 10,000 each day, and have done that through expanded sites as well as expanded hours. So we were trying very hard to have early morning hours into the evening hours over Wednesday and Thursday, to sort of, and really encouraging people to go. So it's a mix.
Are too few people going out and getting tested? I mean, you have a big gap between your capacity of what to test and the number of people who are actually showing up to get the test.
Well, as you know, last week, the city of Boston provided 2 days of testing and was hoping to have, I think, 1,000 people a day. And I think their numbers were between 1,200 to 1,500, again, in response to the mass gatherings and protests. And they don't have their test results in, which goes to your question. So the testing that happened in Boston last week, the test results are not yet in. So between 1,200 and 1,500, they were hoping to have 1,000 a day for the 2-day period, and have yet to get the test results. I'm sorry, what was the rest of that?
Just the gap
Yeah.
between the number.
So again, we want to build capacity. So in the event that we needed to flex because of mass gatherings and the like, right, you have that headroom in order to have people tested and have the lab capacity. So you always want to have more lab capacity than the ability to test, because if you all of a sudden had a surge, right, I don't want people then waiting 5, 6, 7, 8, 10 days to get their lab results back. So the ability of having capacity is the ability to then decrease the amount of time people are waiting to get their test results. That's one thing that's very important. And as we continue to open up our economy, right, more employers may want to have people tested. Universities may want to have people tested. So you want to have that capacity. So, the fact that we had 10,000 people yesterday tested, I think we continue to get the message out that if you are symptomatic or asymptomatic close contacts, we want you to be tested. And we have the capacity to get the tests done.
Governor, can you share anything more about your police certification bill, like the important points that you really want to make sure you include in that?
So we've been talking to the Black and Latino Caucus now for about 6 to 9 months about implementing a certification program here in Massachusetts for law enforcement. And they have those kinds of structures in many other states. And for us, it's an issue around transparency and accountability. And I think if it hadn't been for COVID, we actually probably would have had this thing done a couple of months ago, but that got in the way. And I do think, based on the conversations that we've had with the caucus and with others, that the legislature is very interested in engaging in this discussion. And it's our hope that this legislation, after we file it, can become kind of a platform for that dialogue, and that over the course of the next 45 days or so, before the end of the formal session, we can get something passed here in Massachusetts.
Can you talk about some of the parts of it that you think are really crucial that give it to you?
I think we'll talk more about that when we file it.
Could I throw a quick hypothetical at you? I must love these, but if you do see a spike coming as a result of this 2-day testing or any other type of testing, and a lot of people are concerned about a big spike in the fall that would be more dangerous, more deadly than the initial, would you act quickly to pull the trigger to roll back the reopening?
Well, remember, one of the main reasons we put a pretty robust contact tracing program in place was so that if we did see increases in cases, that we'd be able to make sure that we identified those cases quickly. That's part of what making this testing available is about, and then connect with and help isolate whoever their close contacts were for the same purpose. In the end, we fully expected that at some point we would start to reopen our economy. and that we would try and do it on a cautious and careful basis. But the assumption there was that as that happened, as the Secretary said and as the Lieutenant Governor said when we announced the reopening plan, we are expecting that there will be more people who will want to get tested and need to get tested. And the whole point behind expanding testing capacity and having a robust tracing program is so that we can quickly identify people who test positive, help them isolate, identify the people who are their close contacts, and help them isolate. In some cases, the close contact is going to be the person that gave it to them in the first place. So I think the most appropriate thing we need to do is make sure that our testing ability can ramp and that we do have a pretty significant tracing program in place to be sure that we can actually reach out, connect with, and help those people isolate. Because the way you really get in trouble with this virus is the reproduction rate. You know, how fast does one person become 2, become 4, become 8, become 16, become 32, and the like. And that brings me back, by the way, once again, to all the messaging and all the hard work that people in Massachusetts have done with respect to distance and face coverings and hand washing and hygiene. And I can't tell you how important that stuff is as a big part of the prevention strategy. But if we do these and a bunch of people get identified, we'll work hard to make sure that we help them isolate and that we help their close contacts isolate, because that's ultimately going to be the strategy, whether it's now or in August or in September, that's going to be fundamental to our ability to limit the spread of the virus, along with all the stuff that we've always talked about doing and that people have been really collaborative and supportive of doing.
But if you do have an increase, you're ready to roll back reopening? I mean, we could have to take some steps back if it gets dangerous again?
Well, we've said all along that our goal here is to be cautious about the way we move forward and to use our testing and tracing program to make, sort of quick adjustments to deal with hotspots or issues of significance, either that involve particular populations or issues that involve particular geographies and communities. And we would much prefer that strategy than some other.
Governor, what's been your personal experience with the reopening? Have you gone shopping? Have you gone out to eat?
I got a haircut. I was actually pretty excited about that. The Lieutenant Governor went out to her family went out to their favorite restaurant and ate in a parking lot, and you said it was beautiful. I haven't really done much of that stuff yet.
Governor, we've been hearing that people are still having an issue with the unemployment system. Is
Yeah.
there anything being done to fix that or address that?
So there is I think we announced this a few weeks ago, that there is a major national effort on behalf of some very sophisticated fraudsters, for lack of a better word, who are using stolen identifications, probably part of some of the large previous breaches that have happened, to basically bomb unemployment agencies with very credible data associated with particular individuals to seek to collect unemployment. And we've been working with the federal government and with other states who are dealing with this issue, and basically the end game here is to put a number of additional steps in place, which we understand create timing issues for people, and I wish that was avoidable, but we have to make sure that people are who they say they are, and that means, there's usually, in many cases, a second touch, in some cases a third touch, to confirm that they are in fact the person that they're supposed to be before we can make payment. They don't lose anything in terms of their total value of what they're eligible for, but it does cost them in some cases days before we can get around to sending them the money, because we need to validate that they are who they say they are. These people have really good data who are playing this game, and they are very sophisticated, and it's very important to us as one of the states that got ahead of this, that was one of the first states to create a pandemic unemployment assistance program, one of the first states to do the 13-week extension for the people who'd already exhausted their existing unemployment benefits and put together a very significant remote call center to help the people on traditional UI. We know how important these benefits are, but we absolutely positively have to make sure that that this money goes to the people it's intended to go to, and not to these people who are trying to rip the system off.
Governor,
I'm not going to speak to any of the specifics on that. Washington was, in fact, sort of the canary in the coal mine on this. It was their experience that led to notifications that went to other states, including ours, to give us a heads up that we really needed to get aggressive about making sure that there was representation on this stuff. But like I said, it's very important to us that people get the money they're entitled to, but it's also very important to us that they, in fact, be the people their application says they are.
Governor, can you react to the Supreme Court ruling today?
I was glad to see the Supreme Court ruling. I was also glad to see that it was 6-3. And I think certainly here in Massachusetts, but I would argue across the country, it's important for people to not have their employment status jeopardized by their gender identity, their sexual persuasion, or their sex. And I actually think the way this decision was worded, and I haven't read the whole thing, I've only read some of what I've seen in the news, the basic thrust of the court's opinion was your performance at work should be about your performance at work, period. And discriminating against somebody, not giving somebody a job, taking a job away from somebody simply because of anything that has to do with their sex, their gender identity, or their sexual persuasion is against federal law. And I thought that was terrific. I was glad to see it.